Well, Wolf, we went to the 3rd Congressional District in Nevada to talk to people who are actually going to be affected by the health care reform in the near term. And as you mentioned, we also went there because it is one of those spots in the country where a vote on health care could cost a politician her job. The Las Vegas suburb of Henderson, Nevada is historically a hotly contested congressional district. Freshman Democrat Dina Titus represents Henderson. She was an 11th hour yes vote for health care reform.
I think there are more important things than my reelection, and the health of the people in this country would certainly be one of those.
At the Cupcakery, 20-year-old Jerry Lynn and 22-year-old Cameron are pleased. They'll now have the option to get health insurance through their parents' policies until they're 26, something Cameron may do because he has no coverage at all. But what about the business owner, Pamela Jenkins, who does offer insurance to her full-time employees? Potentially down the line, it could cost you more money. Your thoughts on that?
It could, but it could also give us great tax credits for covering our employees. I already provide health care, so for me, I don't see it as anything detrimental. I see that I'm already shelling out major bucks to these huge insurance carriers, so if we can get a change, I'm for the change.
One of the groups that will see an almost immediate effect from the health care reform are the folks that have pre-existing conditions and were denied health care. This is Glenda McCarty. She went without health insurance for 8 months. She says she's very happy that there are changes now. The reason, you say, is because living without health insurance was a nightmare. Give us a window into that.
Well, when living without health insurance was terrifying. I had to drive more carefully, eat more carefully. Everything I did in my life was with the thought that I had no health insurance and could not get sick. And that was for 8 months. And it was just, I was on edge all the time.
You say this bill isn't everything, isn't that great, but you're pleased with it.
I think the bill will take work, and I think it will take work for some years to come. But the fact that all Americans will be covered, and especially for me, those people without that have pre-existing conditions.
But not everybody here is for it or happy that the health care reform bill passed. This is Dr. Joe Heck. He is a practicing emergency room physician. He is also running for Dina Titus's seat in the 3rd District in Nevada.
There are a lot of problems with this bill that ultimately will do nothing to curtail the spiraling cost of health care.
But something should be done, in your opinion?
Sure. I think if you talk to any physician, they'd say, look, we need some reform. It's very hard taking care of patients in this current environment. But those same group of physicians will say, this is not the right thing to do. There's not enough in there to make this work, to be able to take care of the people that are going to get this new entitlement.
Different opinions from people with different life experiences who will all be directly affected by health care reform.
And there wasn't anything I could say.
The bottom line, Wolf, in this part of the country, jobs and housing are both huge issues, and they will be part of the campaign. But clearly, also health care and Dina Titus's health care vote will come up over the next few months as she tries to get reelected in the 3rd in Nevada. Wolf?
Stay on top of this. We'll get back to you. Ted Rowlands reporting from Nevada.